Hello, welcome. Happy Monday. I'm really excited to get into this topic because I had some really fun conversations with some fellow practitioners and we got to jam on this topic of trending shifts that we're seeing in this world of chronic disease and chronic illness, and I couldn't agree more. And what I want to really talk about today is this huge shift that we're starting to see from what we once knew and defined as chronic disease, chronic illness, maybe even a lot of the reasons that someone would have sought out either healthcare preventative practices or nutritional counseling. And now we're starting to see a whole new wave and a whole new trend of what is considered chronic disease and chronic illness. And I want to talk about it because I think a big part of it is also recognizing that we're seeing how this shift in this trend makes it more and more apparent where conventional medicine is not well equipped to handle this new wave and new shift in what we're considering chronic disease and chronic illness. So what the heck am I talking about? What are some of these high-level thought processes? Well, let me kind of dive in a little bit. So what we used to say as chronic illness is really what we meant was you don't eat well, you eat too much processed food, you eat too much fast food, you don't move enough, you weigh too much, your blood pressure is high, your blood sugars are climbing. And the solution for that in more of our conventional medicine office was we put everybody into the same exact box, right? It's like, oh, we need to find a way to eat a little less, move a little more. The solution was always, oh, if you lost some weight, then all of these issues would go away. Or here's some medications, here's some metformin, here's some statins, here's some blood pressure lowering medications. And it was more of very much a blame game, very much a shame game around, oh, your lifestyle caused this disease. It's because of how you're eating, it's how you're moving. But really what we're seeing here, or at least what I am seeing in my practice, is big shift happening here that is redefining this thought process around chronic illness and also the chronic disease epidemic that we're seeing today. Because now the patients and the individuals that are walking into my office, it's this new wave of chronic disease where these people, they're eating well, they're exercising regularly. They're seemingly on paper to them doing everything right, but they're still dealing with relentless fatigue, food sensitivities, high levels of inflammation, histamine issues, autoimmune diagnoses, brain fog, insomnia, and really just a nervous system that is stuck on high alert and they feel high stress in the skin that they're in every single day, regardless of the external life that they're living, right? And what's wild, what is totally wild, is that all of these symptoms, they don't show up on standard labs. So what's happening is we're getting this huge shift of what is now redefined as chronic illness and chronic disease. But these people are trying to still fit into the old paradigm and the old definition of chronic disease and chronic illness. So what are they doing? They're having some of, like I said, the fatigue, the food sensitivities, the autoimmune issues, the joint pain, the brain fog, insomnia, the anxiety, and they're going to their conventional practitioners asking for labs, asking for help. And those standard practitioners are running the standard labs and telling them like, oh, everything looks ship shape. See you again next year. Do you want an antidepressant? Do you want an anti-anxiety medication? Can I give you some birth control? And individuals are feeling very, very frustrated. They're feeling dismissed. They're feeling gaslit. They're feeling ignored. And then they think their thought process is, I guess I just need to find a different provider. And really what they need to think about is they need to find a whole nother system, okay? Because that whole healthcare system has been trained in more of our classic paradigm of chronic disease and chronic illness. And don't let me fool you into thinking that that doesn't exist anymore. Do we still have a high epidemic of type 2 diabetes and cardiovascular disease and blood pressure, hypertension issues? Absolutely we do. We definitely still have the this epidemic of lifestyle related diseases, no doubt, based off of our standard American diet, standard American food supply, our very sedentary lifestyle. We absolutely still have that issue, but what we're seeing is more and more those individuals that are actually showing up for a health effort, right? Like I said, they're educating themselves. They're doing their own due diligence. They're doing their own research because guess what? They feel like they have to advocate for themselves. They have to learn how to be a doctor in their own body because they continue to go to these conventional healthcare practitioners that are really just treating them under the same model as what chronic disease used to be in the past. And what we're witnessing is an entirely new era and an entirely new definition of chronic illness, one that's not driven by necessarily lifestyle habits, but what we're talking about now today, this is immune dysfunction, this is toxicity overload, this is mitochondrial breakdown, this is a body that's stuck in survival mode, and I am telling you, Western medicine is not ready. And they are not equipped for this. And today, what I really want to dive into is how we're digging into this new definition of chronic illness, how it is changing and why the current model can't keep up. And more so in this, I want to share with you in this episode what every person who has ever been told, oh, your labs look normal, you just need to lose some weight, your body is not broken. The system that you are trying to find answers in that system is broken. So let's really kind of get into the trend that I'm seeing around this big shift between the chronic disease definition of the past and more of the chronic illness definition that we're actually seeing in practice. And this is I don't know. I almost see it as like we're in the middle of this rebrand, but it's not coming from glossy marketing. It is coming strictly because there is a need, there is a want, and there is a brand new epidemic of individuals that are chronically ill and not getting the answers and not getting the care that they deserve, because this is coming from a body that's feeling like this unexplainable and escalating misdiagnosed dysfunction. And when we think about what chronic illness really looks like, let's throw some statistics out there that are very startling in my world. 1 in 10 individuals face at least one autoimmune diagnosis disease right now. And that number is growing. 1 in 10 individuals have at least one autoimmune disease diagnosis. And guess what? Our conventional medicine is not equipped to handle autoimmune patterns right now because their solution to it is just shutting down the immune system. Oh, here's some steroids. Here's some biologics. Here's some things that we're going to throw at your body just to calm the immune system and to get it to just kind of shut up, instead of listening to what is the immune system trying to tell us? Because half the time I see individuals in my office that not only have one autoimmune diagnosis, but now they have 2 or 3. Oh, they got diagnosed with celiac disease, and now they also have Hashimoto's, and now they also have rheumatoid arthritis, and now they also have, it's like, if we're not getting to the root cause of autoimmune patterns, you're going to keep stacking autoimmune diseases, right? These are not separate conditions. These are all under the same immune dysfunction umbrella of chronic illness. And this is the pattern that we're seeing. When we think about 1 in 10 people that have an autoimmune disease, we also have to think about specifically females tend to hold the greatest risk for some of these autoimmune patterns. So women in their 30s and their 40s are being diagnosed with, like I said, things like Hashimoto's, mast cell activation syndrome, POTS, lupus, Sojourn syndrome, endometriosis, IBS, often with multiple diagnoses stacked together. Guys, these are not separate diagnoses. This is your body trying to communicate to you that there is a huge amount of internal, mostly gut-driven, inflammation that is causing an immune dysregulation pattern, and your body is going to pop up inflammation in all of the separate body parts until you listen, is essentially what it's saying. It's like Hashimoto's. It's like, oh, you didn't listen when I went after your thyroid, so here's some IBS. It's like, you didn't listen when I went after the gut, so here's some endometriosis. It's like, oh, you didn't listen when I went after. It's like the body is trying to communicate a common underlying theme here. And like I said, Western medicine is not equipped for that because they operate in more silos and more specialties versus being able to really zoom in and look at the body as a whole. We also are seeing people being dismissed because we're treating mental health separate from physical health. So it's like, oh, you're anxious, or you're just too sensitive, or oh, you're just too stressed, when actually their body is feeling anxious and stressed because they're living in a state of immune hyperactivity and chronic inflammation, right? So this is coming from the body up to the brain. This is not the brain acting rogue separate from the physical body. Like, we treat mental health as if it's not driven by your physical health. And that's where we're also getting this really big separation. And again, a Western conventional medicine model that's not really prepared for this. Not to mention, we have cancer diagnoses in individuals under the age of 50 increasing globally every single day. So to me, all of these statistics aside, the scary part is these aren't the kind of diseases that you just manage with lifestyle tweaks or like a 10-pound weight loss goal. Like, you're not going to out yoga or Ozempic your way out of these diseases. And this is, like I said, just a bigger picture of the landscape that we're seeing of immune dysfunction, mitochondrial burnout, a toxicity burden, a dysbiosis inflammation storm that is then triggering a nervous system and mental health on a very steady decline. And this is starting even as young as childhood, okay? So I want to just, like I said, kind of put that out there, that not saying, like I said, that our classic kind of like lifestyle related diseases aren't still very prevalent and present. They are. But I feel like our standard medicine model has done a pretty good job of offering people some like quick fix. Here's a medication to just lower your blood pressure. Here's a medication just to lower your cholesterol. Oh, here's an appetite suppressant to just lose the weight, right? And of course, what's happening is those individuals are taking some of those Band-Aid medications and they're still not feeling better. Why? Because this was never a weight issue to begin with. This was an immune issue. This is a toxicity issue. This is a gut health issue. This is an inflammation issue. And that's why medicine is not keeping up, is because they're shoving everybody into the same little box of like, oh, you just need to find a different way to like eat less, move more. And it's like, this person has raging autoimmune patterns and they do not fit in that box. Like, stop trying to fit them into the box. Conventional medicine was built to treat acute and lifestyle disease, not this newer wave of chronic immune dysregulation. So again, what do we do? What do we see in this conventional medicine model? It's like, oh, you show up to your conventional provider and you have skin issues, you have rashes, you have eczema, you have dizziness, you feel bloated, you're having heart palpitations, and they just call it anxiety. Right? Or you ask about fatigue and this debilitating joint pain or numbness, and they tell you like, oh, yeah, but your labs are normal. Or you mention that you're having some food reactions and food sensitivities, and they look at you like you're just like on TikTok too much, right? And if you're lucky, you might get some sort of diagnosis, right? It's like, oh, you have anxiety. Oh, you have IBS. But often one of many that they're not really communicating to each other, right? Even like rheumatology isn't talking to endocrinology, gastroenterology isn't talking to immunology. And unfortunately, let's be real, even some of the current landscape of functional medicine has adopted a very same version of this, offering just surface level protocols for things like, oh, you have SIBO, oh, you have mold, you have hormone imbalances, but rarely are we seeing a evolution of providers and practitioners that are actually educated to look at the total system. to really zoom out and see that this is something that is being driven from more of a systemic inflammation picture. This isn't something that we're just going to, like I said, like diet our way out of. This is a bigger chronic illness picture that I'm seeing, and it's not your classic cardiovascular disease, blood pressure, type 2 diabetes. This is a bigger picture of immune dysregulation, mitochondrial burnout, toxicity overload, and a gut that is putting the immune system on overdrive. So what really is driving this new epidemic? Let's talk like the root cause, not just these downstream symptoms. What we're seeing is an immune system here that is under siege. And a lot of people don't understand that the immune system, that is your gut. Your immune system lives in your gut. 70 to 80% of your immune system is in the small intestine. The other percent of it is in the liver, which is also part of the gut, right? So whatever is happening in the gut is happening in the liver. Whatever happening in the liver is happening to the gut. So we can't just have this like old style of conventional medicine anymore that's just putting everybody into this box of coming in and trying to blame everything on your stress, trying to blame everything on the fact that you're overweight, or trying to blame everything on the fact of, oh, you're just aging, right? It's like, no, we can't put people in this box of like, oh, have you tried to eat less, move more? Have you tried to keto? Have you tried to diet? Like, have you tried increasing how many steps you're getting per day? I'm like, this person is in an autoimmune dumpster fire. Like, stop trying to gaslight them back into this eat less, move more box, like the same box that you put people in who are coming in eating like McDonald's cheeseburgers and Starbucks frappes. Like, this is not that person. This person is coming in desperately asking for someone to see them and hear them when they are consciously trying to work on their health and their body feels like it's betraying them. Those are the individuals that are part of this new chronic illness epidemic and who I'm committed to helping, because conventional medicine sure shit isn't. Okay. So what systems are we kind of talking about here? We're looking at an immune system that's under siege here. And this was happening well before COVID, but I do think a lot of the COVID parameters and how we kind of treated that COVID time, like we saw some very novel things being introduced to the human body. And because of that, like the immune system is still trying to acclimate and figure out this world post-COVID. So what we're seeing toxin overload, right? We have a whole world of multiple different exposures to things like plastics, glyphosates, mold patterns, right? Things that the human body should be able to detox totally fine. But when it's too much, it's too much. We're also seeing this whole trend of mitochondrial dysfunction. If you think back to your biology days of your middle school and high school years, you remember probably the mitochondria as the powerhouse of the cell. And it is the powerhouse of the cell, but it is mainly the biggest part of our overall antioxidant system. Our body's going to produce a lot of oxidative stress when it's under immune siege. And so we have all this free radical damage and we don't have enough antioxidants to quench that free radical damage. You're going to end up with a lot of issues, especially a lot of neurological issues or neuroinflammatory issues that show up in mental health as well. So we see toxin burden, mitochondrial dysfunction. I see a lot of poor liver function, people. Oh my gosh, our livers, oof, they are struggling. We're struggling to detox. We're struggling with methylation deficiencies. We're struggling with glutathione deficiencies. Like that toxin bucket is high and that liver is tired. Okay. We're also seeing a lot of gut issues, gut permeability, gut dysbiosis, just a fancy way of saying that we have a lot of, we have the gut that's not keeping out foe and keeping in the friends. Okay. And so now all of a sudden in the bloodstream, we're getting a lot of confusion of what is friend, what is foe. We have a lot of people that have been on a lot of antibiotics in their past. And so we have a lot of fungal overgrowths, yeast-based overgrowth that are causing and driving a lot of this intestinal permeability patterns. And then not to mention like toxicity burden, leaky gut, dysbiosis, mitochondrial dysfunction, oxidative stress happening. Of course, we're going to have a brain and a nervous system that feels like the world is on fire every day. Of course we do. And yet we're out there treating everybody for anxiety and depression and ADD and ADHD and OCD. It's like, well, yeah, my brain would think like that too if my body was so under this siege. So it's not, like I said, this is not a situation where we can continue to put people in this box and gaslight them into thinking, oh, this is your willpower. This is your motivation. This is just stress. This is just aging. Maybe you should scale back on how many calories or how many carbs you're eating. This is a body that is sounding an alarm that the internal infrastructure is breaking down, and our current medical models are really not built to fix it. Which is where, with the lowdown, I am committed to providing a safe landing space for these individuals, because this is where the lowdown methods really shine, is in this new wave and new epidemic of chronic illness, because we don't just chase the name of a diagnosis. I quite frankly don't care. Because the diagnosis to me isn't giving us anything except for a label. It's not giving us really the direction of where did it come from and where can we go from here. Okay, so this isn't about finding a diagnosis and finding a label. This is about really understanding from the root cause, how are all of these different diagnoses and all of these different labels actually related together. We're probably not working with 6 different diagnoses here. Your body is actually telling you one major thing, but nobody has helped you get to the root cause of that before. So instead of all of these like patchwork protocols, we're actually zooming out and putting the body back together again in a very strategic order of operations. So how I redefine care with the lowdown methods is, first and foremost, we're thinking about supporting the nervous system. We're thinking about supporting the adrenals here. If there is a body that has been under chronic illness, we have to make sure that limbic system of the brain, we have to retrain that out of that fight or flight response so that healing can truly begin. Once we get the nervous system out of the way, of course, we're going to be talking about drainage and detox pathways. Those are going to be huge. We have to also think about the mitochondria. We have to think about the immune system, and we have to think about too nutrients and nutrient status, because that is going to be a key cellular information for us to be able to really calm this overall immune and inflammation storm. And we do all of that by looking deeper than just your basic blood work. Okay. This is us getting into things like, would you be a good candidate for stool testing? Do we need to see what's going on in the actual microbiome? Do we need to rule in or rule out intestinal permeability and fungal overgrowths? Maybe we need to be looking at some deeper hormonal panels like a Dutch test, so that we can actually see what the heck are your adrenals doing on a day-to-day basis. Why does your body feel like it's stuck in a state of fight or flight? Instead of just adding more hormones to the picture, why don't we look at the terrain? Why would we add more hormones into a system that cannot adequately metabolize or detox the hormones that it has? Okay, so very strategic order of operations where we're using more than just blood work. I think blood work is always a good starting spot, but it should not qualify or disqualify someone from treatment just because your blood work looks normal. That means that we're not looking in the right place then. Okay, there's certain clues and certain breadcrumbs that we can get from blood work, but ultimately it's like the blood work to me, I always tell people, I'm like, I start with blood work for you in a functional wellness consult because that's part of my initial evaluation. Is that the full evaluation? Probably not. It's going to lead us down these appropriate breadcrumbs for you to truly start to understand what is that root cause lens in a way more amplified state than just like looking at your basic blood work and saying like, oh, ship shape, labs look normal. Here's an antidepressant. Here's a vitamin D. Why don't you get a B12 infusion? Here, maybe do you want some testosterone? I'm like, oh my gosh, we are doing such a disservice for individuals, honestly, in both conventional medicine and even in some functional medicine spheres. I'm like, we're not getting it. We're truly not getting that we can't just throw Band-Aids, which is like more hormones, more appetite suppressants, more medications at people to just artificially lower these numbers on a lab when someone is in this new state of chronic illness. It's not just throwing medications at them anymore, and it's not just dieting them to death. This is truly looking at the internal landscape of overall immune dysregulation. So here's the truth that I kind of want to leave us with. whether you want to, like I said, jump on the train or not, chronic illness is evolving. So whether you are a patient out there and you're looking for better care, or you're a provider out there and you're committed to offering better care and you want to actually evolve your skill set and evolve your practice to meet the demands of this new wave of chronic illness, we got to do better. And that is not going to be found in the Western conventional insurance-based model that's only going to cover these like basic lab blood work panels maybe once a year, and some of these like basic foundational generic medications that we're just going to throw at it. Like, no, that system is not built for this. We need a whole nother system, and that's what the Lowdown has been committed to building. I've built that new system so that individuals have a safe space to land outside of that model where they're not belonging. They're falling through the cracks, and nobody is spending time with them to really hear their story, gather their health history, start to put the pieces of Humpty Dumpty back together again, and truly give them a holistic and comprehensive lens of where a lot of their symptoms are coming from and what that ultimate treatment plan is going to be. And so know that, like I said, this next generation of practitioners who say enough to just these outdated models, copy and paste protocols, and just this like partial healing, throwing medications at it, that's just not going to be it anymore. So if you, like I said, are a patient out there and you feel like you're floundering, I encourage you to, like I said, look outside of that model that keeps failing you. Click over to the link in my bio, learn a little bit more about what I do and my philosophies here at the Lowdown and with my Lowdown methods. Schedule yourself a functional wellness consult where we can actually order labs that matter and have someone walk through that process with you to understand where are the breadcrumbs leading us. What is the bigger picture that this is telling us versus just treating a number on a lab or throwing another supplement your way. Because I promise you, there's more. Okay? So hopefully see you guys next week, and we'll build more on this epidemic of chronic illness that we're seeing.